Drug, alcohol, and tobacco use is the #1 adolescent health problem in Arizona today. DrugFreeAZ.org is not only working with parents to prevent this problem, but with healthcare providers as well.
Healthcare participation is so important because for a long time this issue was just thought of as a social issue and not necessarily a health issue. And so what we've been working to do is to reframe it as a health issue. And because it is. I mean, drug use impacts a child's health and well-being.
One way to preserve children's well-being is to have healthcare providers screen their patients.
I would encourage every practitioner out there to make sure that this is part of their interview and their exam.
Physicians are uniquely positioned to influence adolescent substance use. The American Academy of Pediatrics recommends pediatricians provide alcohol and drug screening and counseling to all adolescents, as well as children in upper elementary grades.
I am a figure of authority when they're in my office, so I think it does make an impression, and I think they hopefully remember what I say.
A standard healthcare practice is SBIRT. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It is an evidence-based approach to identifying patients who use alcohol and other drugs at risky levels with the goal of reducing and preventing related health consequences, disease, accidents, and injuries. The screen used in the SBIRT for adolescents is the CRAFT questionnaire. It's a behavioral health screening tool for those under age 21 and is the screening tool recommended by the American Academy of Pediatrics Committee on Substance Abuse.
The science behind it shows that really the CRAFT questionnaire should be given to the patient either during the physical exam part when the parent leaves, or, if the doctor can then ask the parent to leave.
Screening using the CRAFT begins with 3 opening questions. The adolescent is asked to please answer these next questions honestly. Based on the answers to those initial questions, the screener then takes the next step. The next set of questions is related to the 6-letter acronym of CRAFT.
What it stands for is car, relax, alone, friends, forget, and trouble.
These key words allow providers to ask young people if alcohol and/or drugs play a role in their lives. For example, C is for car. The question is, have you ever ridden in a car driven by someone, including yourself, who was high or who had been using alcohol or drugs? R is for relax. Do you ever use alcohol or drugs to relax, feel better about yourself, or to fit in? Based on the child's answers, positive reinforcement, a brief intervention, or a referral to treatment will take place. When should the screening begin? The American Academy of Pediatrics recommendations for preventative health care suggest beginning alcohol and drug assessments at age 11 and continuing to assess drug and alcohol use each year after.
The information or the discussion about substance abuse can be done not just by the primary care provider, but a nurse practitioner or a physician assistant in the office, or a healthcare provider if they have a health consultant in the office as well.
Why is screening so important? Studies show underage drinking and drug use leads to unintended injuries and death, aggression and victimization, infections and pregnancy, and academic and social problems. Drinking during adolescence also increases the risk for alcohol dependence later in life, and heavy drinking and drug use may result in structural and functional changes in a young person's brain.
We know that 90% of our most addicted adults today started as teenagers. So whatever we can do to get in there, to intervene, and to prevent, we do a lot to offset that addiction later in life.
You want your practice to be healthy, all of your patients, and this is a good way to keep them safe and keep them healthy.
DrugFreeAZ.org provides training to healthcare providers, medical teams, and hospitals on incorporating SBIRT and the CRAFT screen into everyday practice. For more details, please contact us at partner@DrugFreeAZ.org or call 602-264-5700.